All right. Welcome to our first webinar after the summer. My name is Maja Magnusson. I'm co-founder and CEO of Care to Translate, and I will be your host today. We will talk about language barriers and how to overcome them in municipal healthcare. And helping me elaborate on this topic today, we have Liv and Marit from the municipality Molde in Norway. And they have been using our digital translator for approximately 2 years now and can give you some great insights in how they are using it and what effects they have seen. So before I will introduce them even more, I want to give you a brief overview of Care to Translate in case you haven't seen our company and tool before. I will also give you a live demo just to give you an impression of how it will be used actually in the daily care. And then I will welcome Liv and Marit to tell you more about how they have been using Care to Translate. After, you will have the chance to ask questions and hopefully get a lot of answers. So please use our chat to ask your questions, or of course, you can ask them verbally later on. Okay, starting with what is Care to Translate? It is a medical translator for caregivers and care recipients. You can imagine it being a vast library of verified phrases, over 3,000 phrases we have in our library currently, and have translated them into 45 languages. And all content is verified by native speakers with medical expertise. And you can use our app on mobile devices, such as your mobile phone or tablet, and you can also use it on a web browser on your desktop. As I told you, the app is available in 45 languages, and you can use it online, but also offline, which can help in certain situations when you have shaky internet. And also one benefit with the app is that we do not store any patient or personal data. So you can get ready and started really fast, and the implementation will not take long. To give you some examples of where you can use the app throughout municipal care, you can, for once, of course, use it in daily care, in communication with care recipients to help them, for example, get dressed and ready for the day. You can also use it to instruct the person. For example, if they need to start wearing an alarm, how to use it, and how to wear it. Of course, you can use it in health checks and home visits, but I also want to highlight another aspect. You can actually use it to help your staff train their care language. So let's say you have staff members who are not proficient in the country's language. Maybe they have themselves moved here a couple of years ago, and they want to have some extra help and support when they need to speak to care recipients. Then they can actually use Care to Translate in certain situations, in direct contact with care recipients, but also before or after a conversation to check on intonation, for example, or how to say a certain word. To adjust the app to specific situations or even different departments, you can customize it with ready-made templates that we have in our platform. You can also modify them based on your unique needs, and then you can share these conversation lists with your entire department, which also helps to ensure consistent communication and have the communication easy, accessible when you need it. Some practical examples when to use Care to Translate. I already mentioned daily care. For example, to say, "Good morning, did you sleep well? What clothes do you want to wear? Can you please show me? Or do you want me to help you?" Of course, you can also use it to handle medication, to ask, did you take your medications today? What time was it when you used the medication? Show me what medications you have taken today, please. Or to ask about pain relief. And I have many, many examples. So please, if you want to learn more, you can ask me afterwards as well. And now I thought it was time for a demo to actually show you the app and how it works. And I will show you the app on our web app. And when you enter the app and you have an account, you will enter your playlists that are set up for your specific needs. And playlists can be more general. You can introduce how the app is used and what it is. You can give information, for example, about interpreters or payments. But to show you a bit more concrete example, I will use the urinary tract playlist that is also built upon an index that is used in Norway. So when I open the playlist, I enter a set of predefined phrases that I have structured and ordered. And to translate, I can simply press the phrase and it will be played in text and sound.
Jeg skal stille noen spørsmål først.
So in this case, I used the app to translate to Norwegian. But if I want to change the language, I can simply choose the language picker. And I can also search for the language I want to use. And maybe I would like to translate to German. In this case, it's a gendered language. So it considers the recipient's gender as well. And I can select the gender. And now I'm back in the same list. And now I can translate to German.
Ich stelle zunächst einige Fragen.
And as you can see, here are certain questions or also instructions you can ask. Some of the questions have a image icon, and I will show you what that is used for. But to translate the phrase, I simply press again.
Auf einer Skala von 0 bis 10, wo 0 überhaupt kein Schmerz und 10 der schlimmstmögliche Schmerz ist, wie sehr tut es weh? Zeigen Sie die Zahl mit Ihren Fingern.
In this case, I give the patient the opportunity to indicate the severity of the pain, showing their fingers. But if that doesn't help enough, I can also show the image support that we have set up for this phrase and ask the pain to show me on the scale. So if needed, there is support for images as well. I can always search the entire phrase library for phrases that I might want to use. So just to give you an example, if I type in the word blood, I will get the word itself, but also related phrases. And I can simply press the word and translate it to the selected
Blut.
language. And another tab that you can add if you want to is the interpreter tab. In this case, you can actually select what type of interpreter you would need to use. You can schedule them through scheduling links, or you can also use the tab to add a phone number and to call the interpreter right from the app. All right, and this was the app. Going back to our presentation, just quickly to explain that the app is currently being used worldwide, and we're really proud because only this year we have gained new users in 136 countries, which also shows the big need of language support in these areas. And more than 7 million translations have been performed in our app so far. We have different kinds of customers in 11 countries. Customers can be clinics, it can be hospitals, regions, or municipalities. And that type of customer and use case we want to talk about today. And just to clarify, because municipal care can differ from country to country, and having most listeners joining in from Sweden and Norway, I just wanted to show that when we talk about municipal care, it also includes primary care. So when Liv and Marit will speak today, we will talk about home nursing care, but also legevakt, which is emergency clinics. And this is when I welcome Liv and Marit. I will stop sharing my presentation and hand it over to you.
Thank you so much. Thank you. We'll start sharing our presentation.
There's a delay. Can everybody see our presentation?
Yes.
Good. My name is Liv, and I am a cancer coordinator in my municipality. My work mostly consists of going home to the cancer patients that live at home and help them in our system. And we've been using the app for 2 years. I have been using it consistently over time because of war and different things around the world. We have a lot of people from different countries coming to us, so we have used it a lot. And to implement this in our municipality, we have some important factors for success. I think it's very important that the leaders in the municipality care support the decision that we use the app, because if the leaders don't say to their workers, we have to use it, then you don't get anywhere. It's really important that the IT department is on board. In my municipality, we have rovers. Is that a phrase everybody knows?
Handheld devices where you can use the app and you can also communicate with the patient and also the journal systems.
And of course, if the IT department doesn't download this, we can't do it on the devices. So we have to have a good, we have to work good with the IT department. And there also needs to be an organized how-to instruction for the users. So you can see a video or you can read an article where it says, this is how you do it. In my municipality, we have made a video. It's the one you see lying there. We have a studio in my municipality, and we booked us and our leader made the video, and then we instruct how to use. We have also made a newsletter. It's the link in the middle, where there are information about the app, how to use, and the password and everything. So it's ready to use. We also have made a procedure in our quality system. Everybody who works in our municipality have access to this. We also have resource persons with phone numbers. So if everybody wondering how do we do this, they can call me and Marit and we will instruct them. I think this is important. And me and Marit, we all go around the teaching. We say, do you remember to use the app? Have you heard about Care to Translate? So we have to say it very many times to be heard.
Yes.
Understand?
Yeah.
Will you show the web version?
Yeah. So Maya already showed you the way how to use the app, but we also would like to show you. So I'll just change. Here we go. Are you able to see, Maya, what we're sharing now? The Care to Translate web version? Yes.
Yes.
So we're just going to show you how easy it is to log on. So we have our username and our password, and then we just log in. And we have the lists we are using. So I can try to change into English so you can see the names in English.
And like Maya said, there are 45 different questions, languages in the app. And in the app, you can use it as a healthcare provider. If you go back, you can use it as a healthcare provider, or you can use it as a patient. And you can swap while using the app. So that is very useful. And as you speak, you are always able to change the language. I think one of my experiences is very important to talk to the patient and be sure you have the correct language, because if the hospital says he comes from Uganda, and you think, oh, that must be Tigrinya, but then there's a different language. You always make sure you have the right dialect and right language. I have also made my own playlists on the app. Can you go back to the presentation?
Do you want them to see your?
Yeah, you could.
Here you have the lists that we have made.
Because as a cancer nurse, I often use the ESAS, the Edmonton System Assessment System. And I think it's useful to have it translated in Care to Translate, because these are often yes/no answers. So it's easy to use. So what I did to make my own playlists, I sent all the questions to the Care to Translate team, and they made a new playlist. Many of the phrases were already in the app, so just put them together in a new list. And there were a few of the phrases were not in the system, and they sent it to the Translate team to have the correct language. And we paid a small sum per phrase. I think it's very useful. This is maybe what I use most. And I think one thing that's great with the app is that you can use it for illiterate people. It can read the phrases out loud. Well, that is also useful. But of course, the app can never replace an authorized translator, but it can be used as a useful supplement if your patient can speak a little bit Norwegian, a little bit English. So you can, if they speaks none of it, I think it's not so easy to have a conversation. And the app have the possibility for yes and no answers, and some very few explanation phrases, but it's mostly used for yes or no. So if you're going to have a long conversation where you're going to explain very many things, it takes too long. And also the app has a very good search function, so that saves you time if you jump in the conversation from one topic to the next, and you don't have a set list. It's useful. And in Norway, we also have a new patient we have some standardized
ways of handling a patient. If you think they have cancer, or if they've proven to have cancer, they go through the system in the same way, and it also goes very efficient. So,
and we have a new one in Norway called it's the package for coming home from the hospital, and there you have some set questions to go through. So I'm sending those to the team to translate. I think that will be very useful. And I think what you must remember about this app is that it's quality assured, unlike Google Translate. If you put something into Google Translate, it's not sure what's coming out. We have some experiences. It's not very useful. And this app is made in association with healthcare professionals and approved translators for each language. So you are sure that what you put in is what you get out. And one useful tip for use in the app is you can screenshot the phrase you want to be sure the patient understands and send them as a text message. That's also a way to make sure that they have it in writing and by mouth.
And I can just contribute. When doing screenshots, when we do tuberculosis screening of students or workers that come to our county, we ask if they're comfortable receiving an email that's crypted. And they normally say yes, and then I will just screenshot from Care to Translate what I want to say to them. If it's latent tuberculosis or if it's no sign of tuberculosis, I would communicate that also in an email. So it has a lot of use, and we use it a lot. So I started talking now, and I'm the assistant municipality physician in Molde. And I heard about this app through our CDC. It's called Folkhälsoinstitutet, had a presentation. And I was very swiftly convinced that this would be beneficial for us. And I'll just show certain examples where I see the need as a physician in a commune. I see there's a great need when I'm waiting for an interpreter. A lot of times the patient come either to the emergency room, the emergency clinic, and it turns out they don't speak Norwegian or English or any language I'm able to communicate with them. And the app is great in being able to communicate when there's an emergency, and time is of the essence, and before we have a translator. And the same when patients come to their GPs in Norway, we have general practitioners that have take care of a certain amount of patients, and we see many people are still a little bit overconfident and think they can communicate with their doctor well enough. And when you sit there in the appointment, you soon discover that you aren't communicating well. And the app is also a very good supplement in such occasions. We also have a lot of institutions when you're a county like us. So we have nursing homes, but we also have something in between a hospital and a nursing home. And the places where you have patients 24/7, you're not able to have an interpreter 24/7. So the app is great for use in such occasions. And we have a growing population that doesn't have Norwegian as their mother tongue that come to nursing homes and also receive home care. So that's also a great use for us to be able to use the app. And also going to use an example of how we use the app when we have tuberculosis and we give directly observed treatment. So I prefer to show this through cases. And one case I experienced, I came as a first responder to a truck accident. And the patient only spoke her mother tongue and not a language that I was able to communicate in. So I would pick up my app and I would go through the pre-made list for a neurology exam. So I went through the whole list and was able to tell the emergency communication and also the people driving the ambulance. I could explain to them my findings. So I already had done a neurology exam on the patient on site with the app, which was great use. So that's one great opportunity. Just to show you how the pre-made list, and we had great help from Maya and her team to get already pre-made lists that hospitals are using and other institutions that are similar to us. So we had this list for neurology exam, and all these questions I was able to just, as Maya and Liv showed you, just pressed on and it would read it out loud for the patient. And I was also able to see that the patient understood what they said, which was also very important information. The patient would do, follow my finger with your eyes, the app would say, and the patient would follow. So a lot of great information and really accessible in a time of crisis. Another case, we had a patient visiting from Asia, visiting family in Norway. And if you stay in Norway for more than 3 months and you come from an area with a lot of cases with tuberculosis, you have to go through a tuberculosis screening. So what happened was that it was proven that this patient had cavernous tuberculosis, which is really contagious. And the patient had to stay in Norway for 6 months in order to get the patient's treatment to be cured from tuberculosis. And after a certain number of weeks, you aren't contagious anymore. So you leave the hospital and you get to go home, and you still receive the treatment every single day for 6 months. So for our personnel to communicate with the patient, the app was great. So they would be able to communicate with the patient on a daily basis through the app. And here are the examples of from the pre-made list about tuberculosis. So they will tell about that the disease is treatable, that we treat it with antibiotics. They also talk about side effects that are very normal and could be expected. So the red capsule can turn body fluids red, for example, urine. So this app is great in order to communicate with patients in such cases. Maya has already talked about our emergency clinic index, which is we have a Norwegian system for the emergency clinics where the people answering the phone go through indexes. So the example Maya showed with the urinary tract, we also have, I'll just going to show you, we have a lot of other things that they also go through indexes. So it would be a person that are unconscious, or a person that has that is bleeding, or a burn, or if you have chest pain, diabetes, other things. So there are lists for everything. And we see a lot of the patients, they show up in the emergency clinic because they're not able to communicate on the phone. And then it's great to have this index in order to communicate in just the same way with the patient. So Maya would also be able to talk a little bit more about how you would do that when I'm done speaking. So it can be a great supplement in an emergency clinic setting to be able to communicate with the patient that doesn't speak Norwegian. Another case shows when you're a general practitioner, a physician, and the patient thought he or she would be able to communicate well enough in Norwegian with you, and it turns out it's not good enough. And this example is if we didn't have the app, we wouldn't have been able to communicate at that point. And as a general practitioner, you only have 15 to 20 minutes. And the rest of the schedule is full. So for this patient, if we didn't have the app, the patient would have had to come back another day, or to come to the emergency clinic at night. And it turned out that the patient was having symptoms of an arrhythmia, and it was a fast-paced atrial fibrillation. And with an ultrasound scan, we could prove also heart failure. So through the app, being able to communicate with the patient, we were able to diagnose the problem, and also actually admitting the patient to the hospital. So what would have been a delay and could have been severe problem for the patient, we could handle through the app. So also a great example of how the app is very helpful as a general practitioner.
And there's also a big difference from speaking normal Norwegian and speaking healthcare talk.
It's very hard to communicate heart failure and arrhythmias to a patient speaking Norwegian as well. So when you don't have it as a mother tongue, it's even harder. And I also have another example where you're at the nursing home and we have a patient from Ukraine, and the patient is having diabetes, and the patient needs to be seen twice a day. And with the app, it's much more easy to communicate, and we can feel safe that what we want to say is what we say. And being able, it's also a good reminder. Some of these predefined lists are great reminders what you should remember when you talk to a patient about diabetes, or about when doing a neurology exam or doing a chest pain exam. These lists are great to remind you everything you should ask. So that's I've talked to people working in the emergency department in hospitals that also feel the same way. And the patient was able to understand much more about diabetes treatment and what to use if she had low blood sugar. And it's a great way of communicating when you don't have the possibility to have an interpreter every time you see a patient. And another example is in Molde, we have had a great number of refugees arriving the last 3 years, actually as much as 3% of our total population. So naturally, we're going to see more patients in our nursing homes and in our home care that don't speak Norwegian very well. And other cases where, for instance, when you have dementia, it feels a lot more comforting, soothing that somebody tries to communicate in your language rather than everybody speaking a language you don't understand. So as Liv said, we have now a new journal system that's the same for the whole county. And we have these handheld devices that everybody has. So the app is there and the journal system is there, which makes it much more easy to remember that you have a communication tool to talk to the patients that doesn't speak Norwegian well. We also have an inter-county school for pupils that have different, they can have, for instance, autism spectrum diseases and other similar diagnoses. And we also see the need to use the app there as well, because now we have an increasing population that come from countries where they don't speak Norwegian. So we also use the app there as well. Just to show you how easy it is, and how when you have preset lists, it makes a much better flow. So as Liv said, it's harder if you run a search for every single word. So spending the time to make good lists or inherit good lists, as we have done, it makes it so much easier and so much faster to use. And as you see, it covers pretty much everything you want to talk about with the patient in an institution or in a school. So I think that's everything that we have prepared in beforehand. But as you all see, we're very happy with the use of it, and we see a lot of areas in our county where we can use it. And I think the biggest hindrance for us have been to be able to reach everybody. So I constantly remind the physicians and our physicians' offices and the areas where I meet the other healthcare personnel in our county.
And the whole nursing team, of course.
So we use the option all the time. And Maya has also sent us a lot of things we can distribute through our, and also have posters in the offices, and we keep trying to spread the knowledge about the app as much as possible, because as we see it, the app is great, and for me it's as Liv said, to be able to trust that what I'm trying to say is actually what I say. Because we have seen grim examples of use of Google Translate and the strange things that may come out of using that.
And as I understand it, we are the first municipality to use the app. So we are working on the app to make, we can see it is now most used for hospitals and institutions. But we are working to make it more useful for the home care services and others. So we work with the care to translate team to get it better.
All right. Well, thank you so much, both of you, and sharing everything from how it all started to these examples. I think, or I hope, the audience has learned a lot and gotten a lot of insights in how it actually can be implemented and used. And I want to encourage you, if you have a question for me, of course, but especially for Liv and Marit, to ask now or write it in the chat. Yes, so we have one question here from Jens. You talked about the hardware in the beginning. What would be the preferred solution if you had the budget? Are you asking about, I think Jens is asking about what kind of device to be used.
If we want to use it like on a computer or on the handheld device, is that?
Yes.
Yeah.
Yeah.
So in a setting where we use it, where a nurse receives a call or either in emergency clinic or in the GP office, it's much more preferable to use it on the computer, like we showed now, easier to use. But in a setting with a patient, I use it both on the computer and on handheld devices.
Yeah, and the home nursing team, they have the app on their devices. So it's for the home care team, I think that is to be preferred.
And I also talked to the hospital, which also have downloaded the app and also cooperate with you. And they also have downloaded it on the iPhones that the doctors are using and the nurses.
Okay, thank you. Here the next question from Malin. Do you have any recommendations of when to use the app or when to call the interpreter?
Well, I have used this with my cancer patients, and I think the very first conversation, you use an interpreter and not the app. But then you talk to the patient and you see they know a little bit Norwegian, they know a little bit of English, and you see you can communicate without the interpreter. Then I would use the app.
And for me, I think I've showed it through the cases that as a doctor, there's a lot of times that time is of the essence, and we have to clarify if it's an urgent problem that we have to do something about right there and then. And then for me, I need to use it until I get an interpreter, for instance, and to make sure that I don't miss out on important things and the patient has to wait. I think that for me.
Mm. And when you know the patient a little and you have the formalities out of the way, I think the app is great use.
Mm.
And I think for the hospitals, the oncologists have very many informational conversations where they use it to talk about what did the MRI or the CT. That's not for the app. Then you use an interpreter.
And that's also what I tried to show, that it's when they're 24/7 in our institutions where we cannot use an interpreter all the time. It has a great importance. And also in home care visits from our nurses, and it's also impossible to get an interpreter 2 to 4 times a day to do a home care visit. So that's also a great way to use it.
And I would use when you talk to the patient and the next of kin and say, this is the how we're going to do this, then you use the translator. And when you do the day-to-day, how is your blood sugar? Have you taken your insulin? That's a great use for the app.
Right. Let's see. Oh, one more question here from Olga. Can the app be integrated to any other system? Can the information be copied directly to EMR, for example, or does the app give the doctor a summary of what was discussed with the patient at the end of the user case? And I guess this is maybe I can answer. Technically, it can be integrated, but it depends on what system, and for that we would need to have a meeting with the team behind it to see what we can do. But it does not integrate the information into a system as it is built today. So the app, it's a standalone product, and as Marit explained, or also Liv, today they use simple screenshots to inform the patient about what has been said. But we are looking into how we could have the text, the summary of the dialogue, being available as a text. It's not a solution we have on the market at the moment. And then we have also, maybe this is also a question for Molde Kommun, but do you see other areas of use outside healthcare and care in the municipality? So are there any other areas in a municipality that could use this app?
Should I say first? Yeah. So, for instance, in a kindergarten or a school, when you call the parents that their kids are sick, and if the parents don't speak Norwegian fluent, the app could be used to communicate such problems as well. And as I was talking about, we have this school in our area that has a lot of pupils that have healthcare issues. So we use the app there as well.
And maybe to add a question to that, would you, if we had different type of content, let's say content that is not directly related to healthcare, care, do you think there are other municipal areas that could use the same tool or system, but of course with other content?
I think in our region, they have another app that the schools and the kindergartens use in order to communicate, which is more specialized towards their need. So haven't thought about anything. We have been very health focused and health related.
But I have heard some people say that they have used it on holiday to make themselves understood. If you go to a country where you don't speak the language and the person you meet don't speak English, it can be of use.
But I also use, we have adult school for the people that don't speak Norwegian as a mother tongue. We have a huge school system in our area. And I meet the groups there on a regular basis, and I talk about the app, and I ask them to download it. And we have been using it in close communication, close cooperation with our refugee center and our adult learning school.
All right. With that, I think I need to summarize, and thank you so much again, Liv and Marit, for giving us so great insights and answering all the questions. And for you listening in, hopefully we could give you some hints of how you could use it in your municipality to give better care, increase comfort, and also increase efficiency when communication and language would be a barrier otherwise. And if you agree, please talk to your organization and contact us for a trial. And if you're one of 2 first municipalities to contact us today, you will receive a 2-month free trial. So don't wait too long. Thank you so much again, and please reach out if you have questions or want to get started with a trial. Thank you so much, and thank you again, Marit and Liv.